Good day, everyone. My name is Dr. Chukura Neka. I'm a gastroenterologist. Today is World Hepatitis Day. July 28th is set aside for World Hepatitis Day every year. It's a day that will call on everybody to know the burden of hepatitis in our environment. A lot of people, millions of people have hepatitis B and C. Millions also die from complications of liver diseases like liver cancer every year. It's a day we want to remind the government, we want to remind administrators, we want to remind philanthropists that these people living with hepatitis need assistance. Their investigations are expensive, their medications are expensive. We have been calling on governments, we've been calling on philanthropists to assist these patients. The theme for this year's World Hepatitis Day is we are not waiting. We are not waiting. We cannot wait. We refers to every one of us. We refers to the patients, the relations, the healthcare, the government, everybody. Whatever role you have to play in making life easy for patients living with hepatitis B, we're calling on you to do it. We also refers to the fact that as soon as you hear about hepatitis B, that you're going to go and screen yourself. We cannot wait to screen ourselves. We cannot wait to immunize ourselves. We cannot wait to start treatment. As soon as you find out that you have hepatitis, please go to the closest liver specialist available. Now, what is hepatitis? Hepatitis means inflammation of the liver. There are various things that cause inflammation of the liver. Viral hepatitis A, B, C, D, and E. But what we are interested on this day is the one that will cause complications like liver cancer, like hepatitis B and C. Other things that cause inflammation of the liver include alcohol, herbal medications, certain diseases like diabetes mellitus. These are things that can cause inflammation of the liver. But what we are interested on World Hepatitis Day is hepatitis B and C. How can this hepatitis B and C be gotten? Now, the mother can transmit these viruses to the child. Children can get this thing when they go to barb their hair from sharing sharps like clippers. For women that do pedicure and manicure, from needles. Then it can also be obtained from blood transfusion. For those that go to visit quacks where they do not sterilize needles and other surgical instruments, these are various ways where hepatitis B and C can be obtained. Now, what are the symptoms? Unfortunately or fortunately, symptoms are patients usually do not have symptoms. Most patients discover they have hepatitis B or C when they have gone for premarital screening or when they have gone to do some investigations recommended by their to-be employers. So pre-employment screening, and then probably people that just decide to do self-examination. So most people with hepatitis B and C are asymptomatic. They do not have symptoms. However, where symptoms exist, you see that those people feel like they have malaria every week, every now and then. They feel sick, malaise, then weakness, tiredness. Then in advanced cases, they begin to have yellow eyes. Their legs begin to get swollen. Their abdomen begins to get swollen. And then that is a stage of cirrhosis. And then in advanced cases, it gets to cancer. So of course the complication is death thereafter. So these are some of the symptoms that patients with hepatitis can present with. We prefer to see our patients when they are still asymptomatic. At least at that stage, we can prevent them advancing. However, whichever stage it is, you should see the liver specialist. Now, it's important to note that hepatitis C is curable. Hepatitis B is only treatable. Just like patients with hypertension and diabetes take their drugs every day for almost the rest of their life, that is what may happen for patients with hepatitis B. Hepatitis B is not curable, it is treatable. We can control the virus, and as long as we are controlling it, your liver is fine, and then there is no fear about developing liver cancer. Hepatitis B is not treatable, but God has made it that it is preventable because it has a vaccine. So hepatitis B, you can take the vaccine 3 times. At the start, after 1 month, and then after 6 months. So once you've taken the vaccine, you cannot develop hepatitis B. Hepatitis C does not have a vaccine, but then it is preventable. Here in Iyenu, gastroenterology clinic is on Thursday mornings. So if you have hepatitis, or if you have more questions, please feel free to come to the clinic for more consultation and questions. As part of celebrations for World Hepatitis Day this year in Iyenu Mission Hospital, now known as University on the Niger Teaching Hospital, we are doing our World Hepatitis free screening for patients and not for patients, for everybody that comes. And then there will also be educational materials, and there will also be a lecture on that day for those that will attend. It will be on August 3rd. It will start in the morning from 9 a.m. Thank you very much.